Let's get the thoughts now of Christina Pagel, who's a Professor of Operational Research at University College London, a member of the independent SAGE group of scientists scrutinising the government's handling of the COVID pandemic. Thank you so much for being with us. And, well, such a grim milestone that we've been reflecting on in the last couple of hours, 100,000 deaths. Well, we were talking to David Spiegelhalter earlier, who said actually it's probably more like something like 120,000. But what are your thoughts as we think about all those who've lost their lives?
Well, I'm incredibly sad about it. Unfortunately, you know, given the case numbers that we had 3 or 4 weeks ago, which is when the people who are, you know, we knew that this was coming. We've had high case numbers since, you know, the end of September, beginning of October. They've gone up, they've gone down, they shot up over Christmas. And unfortunately, we've seen a worse second wave than we have a first wave. But I'm also angry because it wasn't necessary. We didn't have to be here.
Didn't have to be here. Why? I mean, just talk about the reasons there, because a lot of people point to underlying demographic factors, for example, in this country. The fact also that we're an international travel hub. That meant that our death rate and case rate has been higher than other countries. But are you saying it's much more than that? It's political decisions or lack of political decisions?
Yeah, I mean, certainly those are all factors, but they're all things that we can do something about. We've seen that countries that have stronger quarantine rules at the borders have been able to keep cases out. We know with test and trace, it never worked as well as it could. Dido Harding, giving evidence yesterday, who runs test and trace, said the biggest weak link is people can't isolate, and they can't isolate because they can't afford to isolate. We could have done something about that months ago, and we still haven't. We're still having people who can't stay at home and they have symptoms of COVID because they literally cannot afford to. You know, we've locked down months, weeks after SAGE suggested that we should, advised that we should. You know, we had the press conference on the 18th of December saying there's a new variant, it looks like it's much more infectious. We waited almost 3 weeks to lock down. In those 3 weeks, cases doubled. We've had an extra 100,000 people in hospital, an extra 20,000 deaths. I mean, at every stage, there are things that we could have done and could still be doing, and we haven't.
And our death rate, when we compare it to other comparable nations in Europe, far higher, and it's one of the highest death rates on the planet, in fact. Yeah,
I mean, you know, we're behind some of the really small countries, but out of countries that have more than 10 million people, we're the highest. Yeah, I mean, it's not something, I mean, obviously no one's proud of it, but it's a tragedy. And you know, the Prime Minister said that he promises to learn from it. Well, we can't just promise. We owe it to everybody who's died, to everybody who's been sick, to learn from it. I just wish that the government had learned from it over the last 8 months as well.
But would you give the government credit for example, the vaccine rollout, which does seem to be going very well and better, arguably, than other countries? Almost 7 million people now vaccinated.
Yeah, I would. Yeah, I think, you know, the vaccine programme is going very well, and that, yeah, I mean, I'm not going to say anything bad about it. I mean, it's fantastic that we vaccinated only 10% of our population.
And just looking ahead, what needs to be done now, would you say, that isn't being done?
Well, we're waiting to see what the new quarantine rules are, but I think we do need to have managed isolation now from across the world, just as we're vaccinating the whole population. If you've got high case rates anyway, and you're vaccinating a lot of people, you're actually providing opportunities for the virus to mutate in a way that will evade the vaccine. So we have to get cases down really low here, which we're doing, and that's good, although we've still got a long way to go. And then we have to stop new variants coming in. You know, we need to protect everybody as quickly as we can, and that means not letting in the new variants that we know are there. You know, we know they're in Brazil and South Africa. They will be elsewhere. We just haven't spotted them yet.
We're out of time, but thank you so much for being with us here on BBC News.